Apply the material to your bite fork. You really don't need too much. You can use this material, which is PVS bite registration material, or you can use wax. The problem with the wax is that it can distort with temperature. Place your bite fork in the mouth and stabilize it with your hand. There's a notch in the front of the bite fork. Be sure that lines up with the midline. Once the material is set, you can stabilize it with cotton rolls. Just be sure that it isn't rocking. So go ahead and insert your transfer jig onto your bite fork. Direct your patient to put the Facebow into the ears to where it's comfortable. And then just go ahead and demonstrate to them that you can pull it out and squeeze it in. We're determining the vertical position. And we also need to make sure that the Facebow is level. You can either use the interpupillary line or a level. Using the level will allow me to proper replicate a patient's cant on my articulator. The second position is your sagittal plane. Your third position is anterior posterior. So just be sure that your transfer jig isn't stuck on your bite fork and that the position is passive. Thank you so much for watching. And be sure to follow us on Instagram at 89 Central Dentistry. Bye.